So this software, the 3D slicer and all the softwares that are shown, they are very complicated softwares, and Horos is kind of a light version, you can say. It's a handy tool. Whenever you get a CT scan from when your patient gets you a CD of the CT scan, and you want to immediate information, that can be obtained with this. It's basically a DICOM viewer, but little more processing capacity. So what is a DICOM file? It's basically a medical means all medical files, just like we have JPG file. So this is separate format. It's called as a DICOM. It's a digital imaging and communication in medicine. So all our medical files generally are stored in a DICOM format, and it's very easy to process the DICOM files rather than processing the other kind of files. So there are multiple kind of DICOM viewers. If you search on Google, there are multiple kind of DICOM viewers are available, and most of them you can see the 2D views, the 2D CT scan. As we have taken the CT scan, we get the films, we see multiple tiles. Each tile shows us one DICOM file, the printing of one DICOM file. That is the axial section at that level, and it has its own role, 2D CT scan. But most of the time we get printing the picture like this, and viewing it side by side, it's very difficult to correlate the structures. If they are put one above the other, then when we are scrolling, it gives much more information than viewing conventional slides like this. So now I don't see the slide at all. Most of the patients and the CT scan centers which I know of, I tell them, don't give me slides, give me only the CDs, because that is very easy to see it on a computer rather than seeing those films like that. So more important than is a 3D CT scan. It's a more valuable tool. It gives you the virtual reality. You can create the model, you can see the bony model, you can play around it, you can subtract unwanted structures, you can view it from any angles, you can and it really gives us the enhanced understanding of the fracture pattern. This is a very small informal survey that we have done at our institute, when we have just shown the 3D printed slides, the films of this, and shown it the people in our institute, and asked them the plan, and then we have shown them the 3D printed model on the computer, and they definitely, all of them have opined that their plan of management will definitely change if they see the things on computer rather than seeing on the films. So it really definitely helps in better decision making and planning. But most of the times we get a picture like this, and the area of interest is hidden somewhere inside, and it's very difficult to assess these films and all these things. Though it is better than looking at X-ray and 2D CT scan, but still something better can be done out of this. So that's why we do 3D and 2D processing. So we can view the information that is not usually shown by the planar images. That's what 3D printing does, 3D processing does. And generally, when we are taking the CT, the data, the planes that are taken, they may not be the actual plane in which you want the images, such as scapula and all. So you may not get the planes in which you actually want. So that thing again can be done very easily when you process these images, and it conveys the information in a format very easily understood, and it may replace sometimes costly and riskier studies. We will come to that, and again it can open new markets that we are going to see in the subsequent part of the course. So we generally do 3D reconstruction ourselves, and that we do on a computer. That is, either it can be done either on Mac or it can be done on Windows. I prefer Mac because it is Horos, which is very light version of this, and it's very handy. So I prefer Mac. And these two softwares which are available on the Mac, that is the SORC-SICOT and Horos. So SORC-SICOT, previously there used to be a free version, but now the free version is called a light version. So same developers have come up with another software called as Horos. So I generally use Horos now. So that's the Horos software. This is free to download the Horos software. All you need to do to instruct your radiologist technician to take thin cuts to avoid averaging. So what is averaging? We have already seen. If you take thick cuts, then you get that step-like step-like pattern on your 3D printing. You don't get the proper finish. So that is called as averaging. And the structures in between are average. In between slices get averaged. So we don't want that. So tell them to take thin cuts. And you either tell them to provide the images on a pen drive or a CD drive, and then you can process it. So let's see how it can be done. So this case, we already, I think everybody has got this case. So all those who are Mac, they can do, or the rest other people can do on 3D slicer. So so this is generally when you load the CD or a pen drive on your computer, you have option of import there. So when you import, the series will get imported there. So once the series get imported, then you get all these it will get added into your laptop. So so we are going to study this series now, this patient. So then we have multiple series. Same patient can have multiple series of the CT scan. There can be brain CT scan. There can be abdominal CT scan based on that. So now we are going to use this kind of a series. So this is basically a 2D viewer. Now this is the 2D files are loaded in this. So once I scroll, I can see them. So once I scroll this CT scan up from up to down, I can see the CT scan. So that is the plane it was acquired. That is the plane that is in which the CT scan is acquired. So I am getting the 2D images on this. So still it is better than seeing on the films. So when I come to the level of acetabulum, now I can see that the now opposite side acetabulum is normal and this side acetabulum is badly shattered. So I can see that there is a damage to the femoral head as well. So then we come to the femoral the femur, and that's so. This is basically just the preliminary screening of what we have done. Then after that we have different kind of functions that are available. So the contrast and the brightness of this can be adjusted. So if you want to adjust it, you can adjust the brightness and contrast by turning the cursors right, left side, or top to bottom. So that will change the brightness and the contrast. So that can be done. If you want to reset, you just place Command R, and it will get reset to the normal thing. And we'll see the 3D viewing now. So after that we have the options of 3D viewer here. So in 3D viewer we have different options, that is the multiplanar regression model, volume rendering, or the surface rendering. So most of the time only these three are useful in our clinical practice. There are many, but in orthopedics generally I tend to use the multiplanar regression, the volume rendering, and surface rendering. So I'll first go ahead with the multiplanar regression. What is it? So when you click on this, we get the CT scan in 3 different modules, 3 different planes. So same CT scan which I operated now is processed, and I am getting coronal images, I am getting the sagittal image, I am getting the axial images in the same film. And what we see here are the axes in which these are cut. So I have the option of rotating the axis. So if I rotate the axis, my images on the other film will automatically change. If I rotate the axis, I can shift the point, cross-section point to a particular level. So suppose I am interested into acetabulum, I'll just take this cursor and put it on the acetabulum. And now I can scroll in whatever plane I want. So now I am scrolling into coronal plane, so my axis is automatically shifted in that plane there. The same way, if I want to make it larger, I can just double click on this, and the interested plane will become larger. I can zoom on it to see it in a larger view. I can adjust the contrast the way I want to make it seen better. So this is the basically multiplanar regression. Like we can we can see the images in different plane. That is very useful for when you are seeing the scapula, because the scapula is not generally placed in the true sagittal or coronal plane. And the CT scan what we get, the true coronal or sagittal plane may not show us the proper anatomy of the scapula. So this thing is very useful for scapular fracture or all those structures which are not placed in a true planes. The next thing is the 3D the volume rendering. So if you do the volume rendering, it takes some time to prepare the 3D data of this, and that's how we see the entire model has been made. So what we can see here is the CT trolley there. So that also has some radiological, based on that radiological value, it will cast the shadow. And then we can crop it to the level. So we can crop it to the level of interest. So I'm not interested in, seeing the spine and everything, because that is already cleared. So I'll just crop it down to the level of interest. So I'll cut the CT trolley. I can rotate it like a box again. I can crop it to the level of interest. Once my area is cleared, I can zoom it in. Then I have option to shift it, to the center. Then, so after that, so now I can see that, the left side of the acetabulum is fractured. I can rotate it. I can see it from all the sides. So I can see here that posterior column is intact. Nothing has happened to the posterior column. I can rotate it entirely. I can see that the anterior column is badly shattered. I can see that the femoral head is protruding inside. The quadrilateral plate is fractured. So now I can't see it because the normal pelvis is coming in between. So now the normal pelvis is an unwanted structure, and I can subtract it as soon as I know that nothing is happening on the other side. I don't want to see it any further. So I will just cut it to the level, crop it to the level, and I can again see it. Okay. Again, I will shift it to the level. Then the box tool there, I can rotate it to the way. So now I have subtracted. Now I am seeing the pelvis from inside. So now I can see that the quadrilateral plate is a free piece there, and the anterior column is fractured. So another option is to cut out the structure by using a scissor tool. So I have a scissor tool. So since the femoral neck and head is not in a true plane, I cannot crop it out, but I can scissor it out. So I can just take to the level of where I can cut it the best, and then I can apply a scissor tool there, and I can cut it. So once I have selected the area, I place delete, and the selected area gets cut like that. And then I can again see it from outside to see what is happening there. So that is way. There are multiple software available where you can even subtract the femoral head. As of now, I don't know how to do it in the Horos, the entire head. There is a tool of bone subtraction there, but if the bone are in contact, then it will subtract the entire area. We need to have the bone completely away from the rest of the area for us to subtract the entire femoral head. But when the bone is in contact, it doesn't help that much. So this way we can do the volume rendering, and you can see the entire fracture pattern. Yes. Yes, we can remove that part. So you can use a scissor tool. You can even remove the whatever area you want to remove. You can remove. If you don't want to see the sacrum, you can even remove the sacrum also, and you just delete it, and use a scissor tool, and it will get deleted. So it is more of a virtual reality what you are going to see. The next step of this is to print this model, and model, you will get the model in hand. But before that, we can see it how it looks. So it's a virtual reality, and we can play with it. Now the most important part of this, I want to cut to the level of fracture now. So I'll again use crop tool, and I'm cutting to the level of fracture now to see what is happening there. So same way how I'm going to see in 2D. So I have cut to the level of fracture now to see what is happening. So in this view, I don't see anything particularly significant happening. So I'll cut it in other view. So now here with this view, I can see that there is a big impaction of the articular cartilage there. So I can see that there is an impaction of the articular cartilage here. So that articular cartilage entire piece has been fractured and impacted. So now this is a very important decision making point. If I want to approach this impacted fragment, if I want to disimpact it and put it in the normal place, then from where I am going to assess this. So for this, it is very important to see this 3D model. 3D model, it really helps, because if I crop it out again, so I know now from where it can be assessed. So it can be very well assessed from this point. So I don't need to go anteriorly, I don't need to go posteriorly. So this is a very important tool, in cases of impacted fragment, how to approach that impacted fragment. So from where I am going to assess it, sometimes it is possible. So now in this case I have to, if I'm able to assess it through the fracture site. Many of the times I am not able to assess it to the fracture site. I need to make a bone window for to disimpact that fragment. So where to make that bone window, it's again very important to it can be very well seen on this 3D model. Now there are multiple implications of this also. So we'll go back to the PPT again. Yeah, suppose you want to pass an interfragmentary screw. Again, 3D printing model, it will be very easy, but you can do it also on the computer. So suppose you want to use it, if you want to pass an interfragmentary screw, so you just crop the image to the level you want. So that's the T-shaped fracture. So I can see that there is a big spike there. I can very well pass the supraacetabular lag screw. So I have cut to the desired level. So I rotate it. Now it can be very well seen that that the anterior column is there. From posterior to anterior, I can very well pass a lag screw there. So when I want to pass that lag screw, one of the important thing that comes into mind, whether I'm going to get a purchase onto that lag screw or not, whether I'm going to very much near the fracture site, whether my trajectory is going to be good, and most importantly from where I'm going to start, because posteriorly when I approach by KL approach, the entire thing is covered by muscles. I don't get the I may not get the desired entry point. So that everything can be planned here preoperatively. So I adjust the plane of the cropping, so that can be done very well. So I adjust the plane of the cropping, and then once I adjusted the plane parallel to the direction of the lag screw. So in this direction, if I want to pass the lag screw, I adjusted the plane to that level, and then I crop it to the level where I want to pass the lag screw. So you get to the level of the fracture. So there I don't want to pass. I want to pass much more below, just superior to the acetabulum. So that level I want to pass the lag screw. So if that is the level, then whether I'm going to get a good purchase. So that I'm going to see by when I turn it, look it from the top. When I look it from the top, I know now it's a very big bone. I can get a good purchase if I pass the lag screw at this level. So that one thing is, that one information is got, that yes, there is a feasibility of passing a lag screw there. Next important thing is we can find the entry point of that lag screw. So now I have a pathoanatomical landmark, because when I am approaching posteriorly, I can see that the posterior lip is fractured there. So that posterior lip, the topmost part of the fracture cater, from there I can I can calculate the distance, and I know that around 1.5 centimeter top to that I have to take an entry point. Again, I can take the length of the screws right from the beginning. So that will be the direction of my lag screw. So that is the distance when it is already been displaced, but we can take separate length, and I can get the approximate length of the lag screw. And if that is particularly useful during the surgery, if my length is grossly wrong, then my screw is not in the proper trajectory, or I have not done the proper job. Maybe it is not going in the right trajectory. So if I know the length proper preoperatively, that gives me some information intraoperatively to judge the accuracy of my this thing, other than the intraoperative C-arm that what we are going to use. So we can take the separate length, and that there we can calculate the length of the screw. Again, as I said, to measure the entry point, so that's the superior lip of the acetabulum there. So that's the superior lip of the fracture fragment there, superior part of the fracture fragment. So this I can see. From there I can calculate the distance, how much it is on the top. This much distance I can repercuss it in the surgery to get my proper entry point for the lag screw. Let's skip through this now. So interfragmentary screw, we can see the cross section of the trajectory to assess the bone purchase. We can simulate the screw track. We can calculate the length preoperatively. We can judge the proximity of the planned screw to the joint, and entry point can be marked and reproduced intraoperatively with respect to normal or pathoanatomical landmarks. Then again, what we can get another information is relation to the important structures. So a fracture like this, the fracture is, very much close to the iliopubic eminence, and the direction of the fracture is just like in the line of the vessels. We don't want to know whether the vessel are entrapped into the, gone inside the fracture site, because that is very important when we want to approach this fracture. We don't want to damage the vessel. So that again is very much possible. So important tool is that, you can apply some soft tissue presets to this. It's not only the bone, we can, even see the soft tissue. So this same soft tissue model is on the same CT scan, so which is not been seen on your normal films. So we can apply a soft tissue preset. I'll show how to do it. So we can even get a soft tissue model out of this. So that's the soft tissue model. The yellow, what you are seeing in yellow is the bone. What you are seeing in a dark brown color is the bladder there. And what the two dots which we are seeing is the vessels. So now we can crop it down to the level of fracture. So I can crop it down to the level of fracture, and I can trace the iliac vessels now, and I can see it whether from where it is going and how it is related to the fracture. In this film it is there. So I can apply a soft tissue preset, and I can adjust the value of each component. So if I increase the, sorry for that, I'm sorry, that is not playing there. Sorry, that video is not playing. I can definitely show it to you how it can be done. And then, so another advantages of this is, you can have a very easy storage of data, that all your CT scan are stored, in a single place. You don't need to click the photograph of this. It can be exported to other format like JPG, TIFF, or video formats. You can take high quality images for your publications, and they can be easily transformed into 3D printing format. So that is in a nutshell about how you can process your 2D the DICOM images for the maximum use without using any other formats, other technologies. So, but those have their own value. But this is just a handy tool. Before we can get a 3D printing model in our hand, we can still do some juggleries, and we can get best information in whatever investigation that we have done.
Thank you, Pradeep.
Yeah.